here. Good morning, everyone. I'm Rachel Wall, founder and CEO of Inspired Hygiene, and I'm here today with a few of our amazing Inspired Hygiene team members. And especially today with me is Connie Simmons. Connie is one of our coaches here at Inspired Hygiene. She is also an expert in assisted hygiene, and she and I have been working on a really exciting project together that we are very excited to tell you about today. And it's going to be available in January. But we also just want to give you some insight on our personal experience, what we've seen in client practices about assisted hygiene. And is it a burden? Is it a benefit? Is this part of the solution that dental practices, to the problem that dental practices are facing with the shortage of dental hygienists right now? And you'll have to make that decision for yourself. But we're going to give you a little bit of info just to help you kind of figure that out. And then a really great resource that we think can really help you implement this in your practice, whether you want to do it full force or you say, hey, this is something we're going to do on Tuesdays, and this is going to help us overcome that gap in the number of hygiene hours we have. We're happy to share that with you today. All right. Welcome, Connie. I also want to introduce Driani. She is our client care coordinator, Catherine Gilliam, and Kelly Hemrich, who are both coaches with Inspired Hygiene as well. Thank you all so much for joining me. And I can't see anybody else from the hygiene team, so if you're here, please chime in and let me know, or let Driani know, and she can give you a shout out. So, all right, let's go ahead and get started. Welcome, everyone, and thank you for being here. I do want to do a little housekeeping. We will wrap up before 11 o'clock Eastern, so we'll keep this at an hour or a little bit less is our goal, unless there is Q&A that goes over that, and we're happy to support you in that way too. So if you have questions during the presentation, just drop them in the chat. If we're able to answer those throughout, great. If not, we'll get to those at the very end. And just want to be here to support y'all in this. All right, so our agenda for this morning is to look at a few of these things, or all of these things, and give you just some thoughts, insight, tips on what is the difference between accelerated hygiene and assisted hygiene. What are some indicators that it might be time to consider assisted hygiene? How do you turn the prospect of expanded dental assistant duties from alarming to your advantage? We'll tell you a little bit about the assistant hygiene online boot camp that's coming up. And also, what are the benefits of assisted hygiene to patients, providers, and to the practice? So from 2020 to 2023, the hygiene schedule in many practices was honestly in a state of chaos. It felt like Grand Central Station. You know, the business team was doing the very best that they could to get patients in. The hygiene team was doing the best they could to keep up with the pace. A lot of times they were not able to get the patients in at their desired interval, or they were not able to get patients in for additional services like scaling and route planning. Now, right after the pandemic, they were catching up from, the time the practice was closed. And as that started to settle, that's when our industry really realized that there were fewer hygienists available to work the desired number of hours. So there may be the same number of licensed hygienists, but what we've noticed in the practices that we work with is that a lot of hygienists decided to reduce the number of hours that they were working. So even if there's still the same number of hygienists in a practice, very often there's fewer hours. And we're seeing that trend continue in the dental industry. Has really been working to get creative to address the drop in provider hours. I will say we did a virtual growth forum last month about that particular topic. We really went in depth into what's happening with the dental hygiene schools. And Driani, if you could, when we send out the recording link for this session, if you could send a recording to that as well, I think that's just good context for this webinar as well. So we'll send you that too. It was our virtual growth forum for last month, and it's really, I just pulled together some data that I thought was pretty interesting. So this is a trend that's going to continue. The ADA is doing some things that the ADHA is not a fan of, and a lot of hygienists are not a fan of. The reality is dental practice owners will find a solution to this problem. They have a responsibility to care for patients, and caring for patients is the business that they're in. And I just want to make sure that hygienists continue to be a part of that solution. And so a lot of you have, noticed some changes in the industry as well. So we can solve new problem. We can solve new problems, but we got to think about things a little bit differently. Like I said, dental business owners are getting creative to solve the problem of fewer hygiene hours that are available. And, we are very aware that it's not only dental hygienists that are tough to find. So want to make sure that we just state that right off the bat, is that, it's not as if dental assistants are, walking in your door every day. And we know that that's a critical piece to this assisted hygiene model. But there are some opportunities with the dental assistant. One advantage with dental assistants and dental administrators is that you likely have the option to bring someone fantastic from outside of dentistry with great customer service, a strong desire to learn and build a career. And those are some really great traits. And we at Inspired Hygiene really believe in hiring for character, for motivation, for a culture fit, because a lot of these other things can be trained. There are things happening in practices that are a little bit different all over the country, but across the board, there are some things that we're seeing. Dental practices are utilizing assisted hygiene. Dentists are doing their own hygiene. Several states are looking at an alternative dental hygiene training option similar to the Alabama dental hygiene program. And some states, like I said earlier, are elevating the duties of the dental assistant, like giving them supergingival scaling duties with training. And that can be alarming to some hygienists, but what if it was an advantage to you? I will say, in my 20 plus years of experience as a hygiene coach, very few hygienists that I have worked with in my own clinical career and also in our coaching experience are working fully at the top of their license. So would you all agree, Inspired Hygiene coaching team? I mean, you all have been in practices across the country. So just, you can give me a thumbs up if that rings true. But yeah, very few are truly working at the top of their license. And if they did have that opportunity, and sometimes, hey, I'm in North Carolina, so we just got the ability to give anesthetic about 3 years ago. So sometimes there are state restrictions on that, and sometimes there are, I will say, logistic and just practice obstacles. Sometimes there are mindset obstacles within the hygienist themselves or within the team that hold that back. But if the hygienist is truly working at the top of their license, then wouldn't it be great to have that relationship with an assistant that could really help you support that and really do the very most that we can for our patients? So often it's, again, due to a lack of time or even awareness of what the next level of dental hygiene looks like. It's so much more than a prophy and bite wings, and it's always evolving. And I am very supportive of elevated duties for hygienists as well. I think the dental auxiliary professions are going to look much differently in the next 5 years. Connie, what would you like to share before we move on to the next slide? Oh, did we lose Connie? All right. Well, let's go here. So, Connie, just shout out if you're there. I think she might have had a little technical difficulty. So let's talk for a few minutes about how Inspired Hygiene defines assisted or team hygiene. And we use those terms interchangeably. We feel that this definition of assisted hygiene is the philosophy of the most sustainable model. It is care provided by a team that is working together to create a practice focused on patient benefits while working smarter and not harder. The biggest points that we want you to acknowledge here are team, which has to be present for this to work. All team members must be involved in every aspect of patient care, right? The administrative team must be on board and understand the model in order to be able to schedule that and to be just supportive in general of this model. The patient benefits include having multiple people responsible for their care, as well as the ability to have other procedures and adjuncts completed in fewer appointments. And finally, not necessarily working harder, but working smarter. And this brings us to what our version of the model is not. So it is not designed to double the number of patients or to increase the speed of appointments, or in other words, reduce the amount of time that the patient is in the chair, right? That's what I think everyone is aware of. And I think that's the difference in our minds. I mean, obviously, it's a word selection, but in our minds, when we first mentioned using the assisted hygiene or team hygiene model to our clients, many times their immediate response was they thought of accelerated hygiene, meaning we're doubling the number of patients and, oh my gosh, all I'm going to be doing all day is scaling. And this is just not going to be fun. It's just like, wringing every bit of me out, in that operatory. And that's not what we're talking about here. The word accelerator or accelerated, gives the impression that everything is suddenly thrust into high gear and is moving faster. And when we speed up in order to cram more patients in on the schedule, most likely quality of care is going to be affected. What we've seen when there's less time is diagnosis is affected as well. So although our ideal model is not designed to double patient volume, there are lots of different levels that this model can be implemented. And in the Assisted Hygiene Online Bootcamp, we're going to go into detail about those different levels. We will also go into detail about the levels of the dental assistant that matches with that level of assisted hygiene that you're looking to do. And there's not just one way to do this. It really is dependent on the office philosophy of care, the experience and preferences of both the hygienist and the dental assistant, and the office needs for an expanded service mix. And so maybe you've already experienced a more advanced version of assisted hygiene than how we define it, and it's working well. And that's awesome. If it's working for you, then by all means, keep at it. We've had clients that have worked a more advanced level, and on the surface, it seemed like it was working well, but it was not sustainable. The hygienists were getting burnt out, and it was being felt by the patients, and it was just not a sustainable model long term. And that really is our goal, is that whether you decide to use it long term or not, that it is sustainable for the whole team. It is transferable to other team members, and it's attractive to prospective new team members and your current team members. And it still meets the goals of the practice in terms of standards of care and profitability. So this is one of our core beliefs at Inspired Hygiene when it comes to our coaching, is that patient outcomes drive business outcomes. So it's an incredible feeling to have healthier patients due to your efforts. And when we get healthier patients due to the appropriate services, practice production organically increases and the team feels more empowered, right? It's frustrating when a hygienist is trying to address periodontal disease within a prophy because there's no time for that patient on the schedule, in the next 6 weeks or 6 months even. And that's not good for the patient, the provider, or the practice. So one of the questions is, do you already have a full house, right? This is just simply some math that you're welcome to take a photo of this, take a screenshot, whatever you prefer. This is a very simple general formula, right? This is not exact to every practice, but in general, one full-time hygienist, which we define as working 4 8-hour days a week and seeing one patient every hour, can take care of about 600 to 800 patients in recare per year. Now, this depends on how frequently those patients are being seen. If you have a high perio percentage, you have a lot of patients in perio maintenance. Excuse me for just 1 second. Okay, thank you. If you have a high number of patients that are in perio maintenance, if you have a lot of scaling root planning in the practice, if you have a lot of new patients that are being seen in hygiene, then that will affect the amount of patients that are able to be cared for in hygiene. But if you look at your patient base and you really look at, okay, what do we consider our active patients, these patients that have been in within 12 to 18 months, really take a deep dive and see if those patients are actually being cared for in recare. And then with assisted hygiene, they can see roughly 30 to 50% more. Sometimes even more than that, depends on how you want to schedule this. But this is just a kind of a quick thing that you can look at and a quick formula that you can use. All right, so I'm going to ask you a few questions, or I'm going to make a few statements. And this is the interactive part of this webinar. So everybody find just like maybe you got a notepad sitting next to you, just make a note on your notepad. I'm going to ask you to answer yes or no to yourself to each one of these statements. Okay. These are some of the indicators that it might be time to consider an alternative scheduling model. All right, here we go. We have available appointments to treat all of our recare and maintenance patients at their recommended intervals. There is consistent time blocked for periodontal therapy, gingivitis therapy, and new patients in hygiene. So just answer yes or no. Current of what state is the hygiene department in currently? The amount of patients currently being seen in the hygiene department is meeting the restorative needs of the practice. We have a solution to our patient backlog while we are looking for additional team members. In our area, there is an abundance of hygienists ready to join our team. Wink, wink. The current hygiene schedule supports positive practice growth. And there are appointments currently available for periodontal therapy or periodontal maintenance or gingivitis therapy within the next 2 to 3 weeks. So I'd love to see if you can just drop in the chat. Did you have mostly yeses or mostly nos? Let's see. Thanks everybody for your interaction here. Mostly nos. Yeah, I mean, you can see most everybody said that. That's where, oh good, we had a mostly yes. That's awesome. Yay, I love that. And hey, even if you had mostly yeses, it doesn't mean you don't need to consider this, but certainly if it's mostly nos, I think this is a good thing to at least have a conversation about. Okay. So what if you could develop a clinical partnership, right? An assistant and a dental hygienist that is so in sync that the hygienist and assistant can predict each other's moves, care for patients at a high level, and be very productive and really get it all done in a day. Get done what you need to get done. So does that sound familiar? Maybe you've seen this type of partnership between the amazing dentist and assistant teams that you've been a part of or observed in your career. Like this has been done by dentists and dental assistants for decades, for probably 100 years. So it can be accomplished in hygiene as well. Now, I think, again, one of the obstacles, and we talk a lot about those in depth in the Assisted Hygiene Online Bootcamp, is maybe hygienists think, well, I don't have as many different procedures as the dentist has. Well, that may be true, but there are a lot more procedures available to hygienists than prophies and bite wings. So that service mix can absolutely be expanded. The assistant, in a really beautiful dance between that assistant and dentist, that assistant is often the one telling the dentist where to go, what's next, and it really keeps things moving smoothly. And the same thing can happen in the hygiene department. So let's talk about a few best practices here. All right. So dedicated hygiene assistant. We recommend this from the start during the times that are scheduled as assisted hygiene. So for example, if you start this out on Tuesdays, you want to have that everybody understanding that that hygiene assistant is dedicated to hygiene on that day when they're working out of 2 rooms. This doesn't mean that the dental assistant is standing around, during this time, I'm looking at this maybe 9:30 to 11. They're part of the team. They're doing the regular things that they're always doing. They're training with the hygienist. They're listening so that they can get in sync with the hygienist. They're calibrating their messaging. They're working on the schedule. They're helping with sterilization. They're being a strong part of the team. And if everything is good in hygiene and it's trucking along and everything's caught up, then they can go help in other areas as long as they can be back when that next patient needs them and when that hygienist needs them. So we do not recommend that you have this person as a floater because they often get ended up being pulled into um, cases or situations that end up taking a long time, and then the hygienist is kind of struggling because they don't have that partner to care for those patients, and that can be really frustrating. Second best practice is start slow. As you can see in this template, this is only adding a few extra patients into the schedule in the morning and then again in the afternoon, just to start, right? Just start slow, get it started, feel really good about where you are with that, and then you have the opportunity to add more if that's your choice. It gives the assistant and the hygienist ample time to work on patient flow and implementation. Next is pre-plan. Planning the day is 100% critical, right? If you just show up at the last minute, it's going to feel chaotic. So prior to the start of the day, the flow is discussed in detail about where each team member will be, and where they should ideally be working, and knowing that that is likely going to change and evolve over the day. But really pre-plan that day, and make sure you know all the procedures that that patient has the opportunity to complete that day. Is there any incomplete treatment, for example, sealants on a child or something like that, that you can go ahead and recommend and potentially complete that day? High touch. So keep in mind that you're offering your patients the best high touch service that you can. So with proper patient education, they'll see that patients are familiar with a multiple provider model, right? When you go to the doctor, the doctor doesn't typically, show up in the reception area to bring you back to, the clinic room. It's typically a medical assistant is bringing them in. They're taking their vitals. They're asking about their medical history. They're asking about their chief concern for the day. And so patients are used to that. And they're used to being able to have conversations with more than one person. So I know a lot of times we have such close relationships with those patients that we get a little nervous about sharing that, but it's really an advantage when you can do that. Also, think about those times when you need to step away from the patient. Now they don't have to be alone. Also, maintaining proper appointment time. We already talked about this, but that is one of the best practices. And again, shortened appointment times lead to feeling rushed. And honestly, what we see is there's very little diagnosis. So it's really kind of defeating the purpose. Yes, you're getting patients in for, the quick prophy if you're on a back-to-back-to-back 30-minute schedule, but that's not really what's in the patient's best interest. It really is having a very thorough hygiene exam that really identifies what is the patient's conditions, what are their concerns, and how can we best serve them. So maintaining proper appointment time allows you to do that. And certainly not last, but last on our list for today is the handoff documentation and just general handoff communication. There are going to be times in assisted hygiene where the assistant is handing off to the doctor for the exam. There are going to be times when the hygienist is handing off, or they're going to be handing off to each other. So have some type of documentation that you can write things down if somebody has to, move on to the next patient. Maybe you have some communication, but it doesn't happen to be able to be right in front of the patient right then. But make sure that there is someone in there to hand off to the doctor when that time comes, so that the patient knows that they're cared for. And I mean, again, think about when you go to the doctor's office, how frustrating is it when you have to explain your whole situation all over again, right? When you're like, I just told this person that, and they typed all these notes, but either didn't say anything about that or the doctor didn't have a chance to read it. So absolutely, we advocate for doing the very best, have somebody, whether it's the assistant or the hygienist, to hand off to the doctor so the patient doesn't have to repeat all those things. That's part of that high touch as well. Okay, so I'm going to share this with you. I'm not going to take a ton of time. This isn't going to be super salesy. I just want to show you what we have here. And then we're going to give you the link to this page before we end today. And then I have a few more closing thoughts. So we are launching our assisted hygiene boot camp in January in 2025. Let's see, hopefully okay, you guys can see our website, correct? Okay, so if you go to, it is inspiredhygiene.com/assisted-hygiene dash boot camp. And again, we're going to give you a QR code and the link in the chat, all that in just a minute. You'll see the Assisted Hygiene Online Boot Camp interest page. Now, right now, there's not a purchase button. Right now, what there is a let me know when this program is available. So what I encourage everybody to do is just at least get on that list. It does not obligate you in any way, but what it does do is everyone that's on the interest list or the wait list is going to get the highest promo discount when this is launched. So we'll give a promo that'll be good for about 48 hours after it's launched. We're shooting for January 9th, but give or take a day or so, depending on how things come together. Those that are on the list will get the greatest promotional courtesy of any of our other promos. So just, even if you're even remotely interested in it, just get on the list, but you're not obligated to do anything. But what you can see here is you can see what you're going to gain. Thank y'all for being patient with me, my voice today. You'll see what's included in each module. So in module 1, we talk about how this can benefit our patients, our providers in the practice. What are some of our opportunities and obstacles that you'll need to really discuss and manage? What are some production and compensation possibilities for the team? Connie goes into a lot of detail on what is the best fit dental assistant and what are some of the hygiene assistant duties and training. How can that be really smooth? Making the most of your huddle in module 3, those handoffs. What are some of those power words that really make this successful? Module 4 is scheduling. So we give you multiple scheduling templates to start with. What does a day look like between the hygienist and assistant? How do they move through the day? How do they plan the day? And then finally, we talk about ensuring that you're maintaining high clinical standards while you're implementing this. You're expanding your hygiene services so that the assistant and the hygienist have more to offer patients, and that you're really elevating the impact on patients. And there are going to be some bonus sessions as well in that too. But I just encourage you to just take a look at this, get on that wait list. We'll drop the link here in just a minute, and you'll see all the objectives and everything there. We also want to thank our sponsors. Let me go back to this. Okay, great. You can see that. You can see those down there. Florida Probe, VoiceWorks, Philips, and On DM. Always appreciate their support. Okay. All right. So we're going to wrap this up in just a few minutes. So with regards to patients and also your providers, we really always look at the triple win. So we believe that anything that we recommend to our clients and our Inspired Hygiene clients, it must satisfy a win for the patients, providers, and the practice. And sometimes it takes some thought and real intentional planning to really make that happen. And sometimes it's super easy, right? So what we've seen with patients in this assisted hygiene model is there's just more time for that high touch care, which includes things like airway screening, blood pressure screening, all those things. Excuse me. I'm gonna let y'all talk amongst. Okay, thank you. All of those things that the hygienist wants to do, but so often runs out of time. And a lot of times what we find hygienists do, and I know I've done this in the past, was we're like, okay, if I have time, I'll do it at the end. And then typically scaling fills the time, talking fills the time, something else fills the time. And there are truly, this is not an exaggeration, life-saving screenings that hygienists perform, and some of those dental assistants can perform as well. So that's a huge win for patients. Also adding additional services that are beneficial for them. And then there's appointment availability, right? It's frustrating. I talk to my friends all the time. They're like, I have the worst time getting into my dentist. For providers, I think, again, it's that time management and having that support so that they know if someone is seated in the other operatory, they are being fully taken care of. So the hygienist, think about all those times that you're with your patient, but there's a patient in the reception area that's waiting, and that's super stressful. I used to have nightmares about that. I'm not joking. I would have nightmares that they were stacked like out the office waiting for me, and I was moving in slow motion. So, that can go away because you have that partner. It gives everybody diversity of services, and you just have that really great team energy. And for the practice, obviously, it can create increased profitability. There's often improved technology usage. Think about the digital scanners that you have in your practice that you really would love to get into hygiene. And also think about that restorative co-diagnosis piece. So when doctor walks in, everything is just arranged and it doesn't feel rushed to anybody, and they can really have pre-presented any restorative needs that they see are pretty obvious. So lots of benefits there. And with anything, we just encourage you to just keep a growth mindset, right? Keep an open mind about it rather than shut something like this down. Just think about that you're constantly learning and growing. There are going to be mistakes. There are going to be days that don't go as well as others. That happens in, traditional hygiene scheduling, but those are just opportunities for growth and learning. Give each other feedback. How did that go today? What felt really great? What felt kind of chaotic? How can we change that? Think about challenges as an opportunity to learn. And really, our efforts and our attitudes determine our abilities and what we're able to accomplish. And it could be something new and exciting. I was speaking to the Charlotte ADOM DPLN a few weeks ago, and there was a hygienist there. And she said, you know what? We had a hygienist on our team that was full time, 4 days, and she just was not a fit for our practice. And it was really causing a lot of problems. And we just decided it was time to release her to her, to what do you say? Free you up for your future. Yeah, they decided to free her up for her future. And what they decided to do is there were 4 remaining hygienists, is they decided to each do assisted hygiene 1 day a week. And they love it. They love it. And the assistants actually rotate from doctor schedule into hygiene. So they're all getting to do something a little bit different every day. And it's actually working out really well. The hygienists get to make a little bit more that day. The assistants might too. I don't know. I didn't get that in depth with her, but that's just a really great example of having that growth mindset. So, Inspired Hygiene team, anything that y'all want to add or share?
I'll jump in, Rachel.
Thank you.
I wanted to say that I never felt more supported than when I worked with a dedicated assistant. She trained with me for 6 or 8 weeks on a traditional schedule to make sure that she knew all my verbiage and exactly what my standards were. And then I had full trust that when she was with my patients, because we get very close to our patients, I knew they were in great hands. And I never felt more like a doctor than when I did
Yep.
assisted hygiene. I was able to work to the absolute top of my license, and it was just a beautiful, beautiful choreographed day between the two of us. So I highly recommend it. I'm so
Yeah.
excited that you and Connie created this.
Yeah, I have to say, I felt the same way too when I've had the opportunity to work assisted hygiene. It's like, oh, I have the support and we're a team and this is actually going really well. So thank you for sharing that, Catherine. I'd love to hear anybody else have any great
Yeah,
things
so
that you want to share.
yeah, so just kind of building on what Catherine just said, I found that personally my dental hygiene assistants, not only were they an extension, but I provided them a sense of leadership
Mm.
that they'd never experienced before, whether they were new to dentistry or new to our office, or they were a very well experienced dental assistant. Working in an assisted hygiene schedule actually just elevated their leadership skills. They were working at the top of their level. And every single assistant that has worked with me directly on assisted hygiene has gone on to be a dental hygienist, or one of them is actually now a dentist. So she went from a hygiene assistant to a hygienist to a dentist. So
Wow.
it
Love it.
just, yeah, it's super, super important for them as well. And as long as we're working together as a team, she's an extension of me, I'm an extension of her or him. And I've had a great male hygiene assistant as well. I just think it's just super important, that teamwork piece, and we're just an extension of one another. And now I have a partner.
Yeah, I love that. I love that. Connie, thank you so much for your work on this assisted hygiene online boot camp. Connie is giving um, her expertise from real life experience. And it's super valuable. And I think you guys are really going to find a lot of value in that. So thank you for that.
Yeah,
Um,
absolutely.
yeah, I'm trying to see what's in
Rachel, I wanted to share quickly.
place.
I trained a hygienist. She was just graduated waiting on her license. So she was my assistant until she got her license. So I was able to train her within the company so she could learn everything.
Yeah.
And it worked out great. I loved it. It's one of my
Yeah.
favorite jobs.
How long did you do that with her?
It was a few weeks, I think
Yeah.
probably 4 to 6 weeks.
Yeah. I love that. Um, all right. So thank you for sharing that, Kelly.